What's up, guys? It's Martin Chavez here with Clean Cut. And today I'm going to be talking about the experiment that I've been conducting for the past few days regarding disease transmission at barbershops. Um, if barbers adapt and overcome, the next time there's a pandemic or an outbreak, you won't be out of work. Imagine if you didn't have to stop working these past few weeks. How would your life change? How would your life be different? We all have responsibilities in our day to day lives, car payments, rent, mortgage, just general bills, right, that we need to pay. Life itself, right? Costs money to live, especially here in California. Price of living is very high. So I want you to imagine that you didn't have to stop working. Your life would be very different, I'm assuming, right? So the experiment that I've been conducting, I learned during my first semester of nursing school, and it shows how easily bacteria, viruses, and all other microorganisms can spread, especially when handling equipment that a lot of people touch, like the reusable capes at barbershops. This experiment is going to be conducted using a substance called Glo-germ. I have it right here actually, and a UV flashlight. So this gel, this actual lotion, it it reacts to the UV light, and flashlight's out. So it reacts to the flashlight, and it illuminates. It's fluorescent, so it illuminates like purplish color, right? So from one professional to another, I know you guys understand the importance of infection control and sanitation because we spent many hours learning about it, right? You as professional barbers have spent countless hours and trained on sanitation and infection control, just like us nurses here in California and all over the country. So in this experiment, you're going to see the transfer of germs to direct contact. You see pictures of my hands, my face, my clothes, my cell phone, and the money that I used to pay my barber, all contaminated with the fluorescent lotion that I used to mimic the transfer of the germs. So barbers and cosmetologists often use the same cape for 10 to 20 clients a day, but it's not their fault. This is a custom that's been followed for decades, and now is the perfect time to change this out of date method. It's completely ineffective regarding hygienic standards. At the hospital, we use a new gown for every patient encounter, even if it's the same patient. I'll go into the room if the patient's contact precaution. We don a new gown, get out of the room, we toss it before we get out, and then if we go into that same room again, guess what? A new gown. So as a professional barber, you should provide the same care for your clients. How would you feel if you went to the hospital and the nurse assigned to care for your child or your family member wore the same gown for the previous 10 to 15 patients? It's disgusting, right? I want you to imagine the situation. The nurse leans in to help your child get onto the scale for a weight, right? When the nurse leans in to grab your child, you spot that the gown that they're wearing is dirty. There might be blood, or other body fluids. You spot that the gown is not new, right? How would you react to this? Would you call the nurse out? I mean, I definitely would, and I'm a nurse myself. That's disgusting. That's not good practice. So in order for barbers and cosmetologists to be acknowledged as the professionals that they are, you must hold yourselves to a higher standard collectively as an industry so that this doesn't happen again. And when it does happen again, because it's not an if it's going to happen again, it's a when it's going to happen again. You guys are going to be ready, right? You won't be out of work. You'll be able to take care of your family, be able to put bread on the table. You know, that this is the plan that our company has for you guys. So, using Clean Cut's disposable capes not only protects against disease transmission, but it also prevents hair from getting on the client's clothes, and this prevents the post-haircut itchy feeling. You know, when you go get a haircut, customers usually take a raggedy shirt, a shirt they don't really care about, right? Because they know they're going to get hair on it, and they feel itchy afterwards. But with our capes, you know, you just take whatever shirt you want, you put on the cape, you're not going to get hair on it, or little to no hair, and then you'll be able to go on with the rest of your day. You don't have to go home and shower. That's one of the first things I do after I get a haircut. I come home and I shower right away because I don't like that feeling. My son as well. This cape prevents kids from becoming fussy while getting a haircut due to the hair getting on them and making them feel itchy. So my son sometimes gets fussy when getting a haircut because he's like, "Dad, I'm itchy," you know. So this will prevent your your clients that are children from crying and making your job harder. Yeah, you have nothing to lose. They're very cheap and affordable, and we're more than willing to provide them to you guys. So barbers are trained to clean their brushes in between clients. But what about the capes, right? They use the very same cape for multiple clients a day. You know, this practice has been around for decades, and it's something that needs to be changed now. Now is the perfect time to change this outdated method. So sure, like some people think out of the box, like, hey, I could purchase a couple of reusable capes. Sure, you can do that. But with these new mandates that the state is imposing on businesses, you're gonna have that extra responsibility of having your capes laundered, and you know that's just an extra responsibility, an extra task in your day that you're gonna have to follow through with. And what if you have a really busy day, you're tired, and or a family emergency comes up and you're not able to get your capes laundered? Are you gonna skip a day of work? Or are you going to risk your client's health and still use those dirty capes? You know, Clean Cut disposable capes takes that responsibility off your hands. There's a clean, fresh cape for every patient. You individualize your haircut. The patient feels safe. They have some sense of health security, and it's a win-win all around. You know, it saves you time, money, and energy, and that extra responsibility, like I said. So I'm going to read some of the opening guidelines for businesses that the CDC and the Center for Public Health has written out. I have the link for them. If you send me a DM, I'll be more than happy to send you the forms. One more. All right. Sorry, I think it's like inverted, right? But if you send me a DM, I'll definitely email or send them to you through DM. So I'm just gonna highlight the ones that pertain to my purpose here, which is the cleanliness of the capes. Right? There's many requirements, other requirements. So number 8 on the returning to work checklist for establishments: clean and disinfect all non-electrical tools that will be used in service, even if it was done prior to closing the establishment. So, capes are non-electrical, right? But they're rarely cleaned. We need to do something about this. Number 9, throw away any used items that cannot be disinfected. This includes, but is not limited to, emery boards, nail buffers. I guess it's more for like nail salons, but throw away any items that cannot be disinfected. I guess you could disinfect a reusable cape, but it's going to be like at the end of the day. Number 16, wash any linens that have been in the establishment. Okay, we already covered that. 17, wash or disinfect all capes. It's in the literature. Wash or disinfect all capes. With Clean Cut, you avoid the responsibility, right? Number 18, store all clean linen in a covered place. but they're cracking down on the hygiene. Number 29. Consider barrier methods on chairs such as disposable paper, plastic covers that can be disinfected, or towels that can be laundered after each client. Self-explanatory. Number 33. Disinfect high contact surfaces items daily, such as telephones, doorknobs, receptions, countertops. What about the cape? The cape is high contact. It goes on every patient, touches every client, that the barber has contact with. This form here is from the California Department of Public Health, and like I said, I'm just gonna highlight the sections that pertain to cleanliness regarding capes. It says clean and disinfect all non-electrical equipment by removing all visible debris, cleaning with soap and water. So freshly laundered towels and capes. All right, so sometimes you go get a haircut, there's hair on the cape from the previous patient. That's pretty gross. Next one. Where appropriate, consider adding a paper cover, sheet, or clean towel that can be easily disposed of or cleaned for between customers. All single-use items such as disposable wax collars, neck strips, all might be thrown away. All right. So I start this because it's important. All dirty linens, including towels, smocks, and reusable capes, should be placed in a closed container and not used again until properly laundered, either by commercial laundering service or laundering process, which includes immersion in water of at least 160 degrees Fahrenheit for at least 25 minutes. Throw all clean linen in a clean, covered place. Ensure workers who handle dirty linens or laundry wear gloves. That sounds like time-consuming. You could avoid all this with Clean Cut. Hair salon or barbershop workers should avoid sharing phones, tablets, laptops, desks, pens, and other supplies wherever possible. Never share PPE. Why are we sharing these reusable capes? Doesn't make sense. It's an outdated method, outdated practice. This here is from the City of Los Angeles Close Contact Services, such as hair or nail salons. Gonna go to the highlighted portions. Complete frequent sanitation, high touch surfaces. Like I said before, capes are high touch items. Disinfect all reusable shareable materials between each use. Provide enough time for workers to clean before, during, and after shifts. Workers should be compensated for time spent in cleaning tasks they are assigned. Launder all towels, tablecloths, uniforms, etc. Between customers, clean and sanitize all workstations and equipment. Shampoo bowls, pedicure bowls, scissors, clippers, nail clippers. But it doesn't mention capes, but not too sure why. I'm going to push this with the board. Planning to fly to Sacramento within the next month or two and sit down and meet with one of the state board representatives. Definitely going to do that. For hair appointments, such as each customer should be draped a clean cape. Consider using disposable capes if possible. Consider, I think it should be mandated. Limit or eliminate use of reusable goods. Boom. Right then and there in the literature. Limit or eliminate use of reusable goods. It's just asking for diseases to be transmitted. Encourage customers to wear PPE in accordance with LA City guidance during service and and consider offering face coverings upon entry. What about body coverings with the capes? Right? Very important. So I'll close with this statement that you'll gain clients just off cleanliness. Simple as that. Thanks, guys. What's up, guys? I'm sitting out here outside of my barbershop, about to go in and conduct the experiment. I've got the lotion here that I've previously laced with the Glo-germ, which is a powder that reacts to UV light. So anything you see later on in the video that's glowing is gonna show contamination, right? Microorganism contamination, whether it be bacteria, virus, fungi, it doesn't matter, right? Well, it doesn't matter because it's your client's health. So, as you know, as you've experienced as professional barbers, your clients come in from whatever they're doing at that point in their life. They might be at work, might be at the gym. They come into your shop, get a haircut. You don't know what's been on their clothes. You don't know what they've been touching. So this experiment is going to perfectly show how easy it is to transmit these microorganisms. Um, Whatever you see glowing in the video later on is going to be potentially contaminated items or surfaces, right? These capes that my company is promoting are disposable one-time use capes, and it's going to play a significant factor in reducing the amount of contamination.